What is Marma therapy? What is Marma therapy? So whenever we see any two junction, like this is one bone and this is the another bone, in the junction there is a possibility to have the storage of energy. If there is a one bone and this bone having connection with muscle, so on the junction they're again having possibility to store the energy. So in our body we are having multiple bones, we are having multiple muscles, bones, ligaments, tendons. So we are having multiple structures, and in the body they are associating with each other. At every junction we find some stories, like we see the road. Suppose this is the road and we can see some ditches on the roads. So in the ditch there is always possibility to have storage of water. So when it is raining, after raining finished, the water will go away, but still it is stored in the ditch. In the same way, in our human body, we are having thousands of thousand junctions, and in each and every junction, we are having some storage facility, some storage house where we can store the energy. So if we praise these points, so we can take out some amount of energy from there and we can release the pain, stagnation, and some problem. Suppose one person having the pain in the arms. So he is having pain in the arm and we are having one point here. This point is the storehouse of energy. So as soon as we do the treatment here, just we do the pressing here, this energy go and spread in whole arm and give good circulation, give warming feeling, and as well as it remove the pain and stagnation. So the Marma points are the points, or we can tell Marma points are the vital points in the human body. When we praise them, so we can use for multiple purpose. The purpose number one, we can heal the person because these are the storehouse of energy. Number two, if we do little more pressure, means the pressure more than required. If we do the more pressure, then also we can harm the person. So in the Marma Kalai, people are using this technique. In the Marma Kalai, people are using this technique. They are doing little more pressure on the Marma points to harm the person. And number three, we can use the Marma points for defending ourselves. Because if you touch the Marma point, you can heal the body. But if you hit the Marma point, you can damage the body. So always, as a healer, we should know that how much touch and pressure required to heal the problem. So the person who are learning Marma Kalai, they know better that how much pressure required to harm the person. But this topic we are not going to discuss in our Marma class. We are just going to discuss the Marma which is needed for the healer. We will see how much pressure is required, how much touch is required. We will learn all these things and we will do the pressure accordingly. Remember one thing, Marma is not a acupressure. Marma therapy is not something like that you are just doing the pressing on the points. This is not a Marma therapy. The Marma therapy is a very scientific stimulation of the point. What is the meaning of scientific here? The meaning of scientific is here. Let's see. We know this is the third eye. The name of this Marma point is Tilarth Kalam, or in the other word also we tell it Sthapani Marma. And this Marma point is very useful. We are putting daily tilak here. Females are putting daily bindi here. If you see, we always stimulate this Marma points in the upward direction. We take the chandan, we take the tilak, we put on the third eye and lifting it up. We're never doing downward movement here. So when we want to stimulate the Tilarth Kala Marma, pressure not at all required. This is not the question of pressure. This is the question of stimulation method. The stimulation method. The stimulation method on this point is that we have to lift this point upward. So when we are putting chandan here, when we are putting some kumkum here and doing little upward movement, that 3-time movement is also enough, very gentle movement also enough. And one more thing, if you don't want to put the tilak or chandan, then even it not required. Means you can stimulate this Marma point without using any chandan, any tilak, any kumkum, just do the movement. So the Marma is not just a acupressure, it is the technique to stimulate some point. I will give you one more example. In the palm, when we see the palm, so look at the palm here. This is the wrist. This is the thumb, index finger, middle finger, ring finger and small finger. Now, in the Marma Shastra, it has been mentioned from this joint, this is called MCP joint or metacarpophalangeal joint, where finger is attaching with our palm. So this is called MCP joints. And this is the wrist. And this is the line in the central part of this palm. This is also called a very good line to treat the heart problem, to treat the heart diseases. So if we do any treatment in this line, anywhere, this is very effective for the heart diseases, heart problem. So this line is That much important if we do the imagination of whole body here in this line, and we divide this line in three parts. From this part, we can treat the circulation in the upper body. From this part, we can stimulate the circulation in the middle body. And from this part, we can stimulate the circulation in the lower body. Okay, I will tell you again. Suppose this is the human body. So when we talk about the heart, and we know heart is here, but if we talk about the peripheral heart, the meaning of peripheral heart is the circulation of heart is going everywhere in each and every body part. So maybe some person is not getting good supply in the head region. So we can tell it upper part of the body. Maybe someone is not getting some good circulation in the chest cavity. Then we can tell it middle part of the body. Maybe some person is not getting good circulation in the lower part of the body. So just by pressing, just by doing the treatment on this line, we can improve the circulation of each and every body parts. So this is the central line, or we are telling it is very good for heart. We have divided this line three parts: upper, middle and lower. And the total length of this line is 6 finger, or in the Ayurveda we tell it 6 angula. 6 angul. The total length of this you can measure in your palm. Let's see my palm. If you see my palm, if I measure, like, see, this is the 4 and this is the 2. The total length of this part is 6 finger. So we can divide 2 finger, 2 finger and 2 finger. Means 2 finger for the upper body, 2 finger for the middle body, 2 finger for the lower body. So if someone is not having good circulation in the upper part of the body, we can stimulate from here. Like someone having headache, dizziness in the upper part of the body, we can just treat from this line, and we can improve the circulation of the upper part of the body from this line. From these 2 finger bits, we can treat the middle part of the body, including heart. If you want to treat your heart, you can stimulate this part. And with the help of these 2 fingers, you can stimulate the circulation in the lower part of the body, like varicose veins. If someone is suffering with a numbness, lack of and poor circulation. So I have seen in the South India, when I went to one temple, he put little chandan here. Then we are touching the middle finger and taking the chandan here and putting on the Tilarth column marma. So scientific tradition in the temple. So they are putting chandan on our this heart line, in the center of this line. And this point is very good for heart because this is the middle part, because they are putting the chandan, which is very cool in the nature. So it is calming down our heart. Then after that, we are taking this chandan, putting on the Tilarth column marma. This marma is directly connected with our pituitary glands. So we are establishing the relationship between heart and pituitary gland. So before entering the temple, before praying the God, very scientific thing. So the core, we are doing the establishment We are making the relationship between heart and brain. We are balancing the heart and brain, because why we are going to the temple, why we are going to the spiritual place, to calm down ourselves, to relax ourselves. So we are doing in this way. So this is a very wonderful line. The center, two finger this side, two finger this side. We are coming from the center. Till here, we can treat the circulation of whole body. From the upper part, we can treat the, if someone is having headache, dizziness, from this line. From the center part, we can treat the heart. And from this line, we can treat the lower part of the body. So that's why, this point has been told, the very good point for the heart. And the name of this point is Tal Hriday Marma, that we know, Tal Hriday Marma. So we can tell the upper Tal Hriday Marma, the middle Tal Hriday Marma, and the lower Tal Hriday Marma. The middle Tal Hriday Marma is good for heart. The upper Tal Hriday Marma is good for the improving blood circulation in the upper part of the body. And the lower Tal Hriday Marma is good for the improving circulation in the lower part of the body. So in this way, we are having 3 Tal Hriday Marma in this palm, 3 in this palm, 3 in right feet, 3 in left feet. So we are having total 12 Tal Hriday Marma and 1 in the center. So 13. In the Kashyap Samhita, it has been told that we are having 5 Tal Hriday Marma. What? If we explore this thing, in the Kashyap Samhita, it has told that we are having 5 heart. 1 heart here, 1 heart here, 1 heart in the right feet, 1 heart in the left feet, and 1 heart in the center. But now with the exploration, we can see 3 heart here, 3 heart here, 3 heart in the right feet, 3 heart in the left feet, and 1 in the center. We are having total 13 heart. So the question arises, how to stimulate? The very simple technique of stimulation. We have to stimulate this point horizontally. See, like how people are eating the chapati, they are keeping here and doing like this. This is the right stimulation technique. If we are taking, because many people are eating tobacco and they are stimulating this point in very right way. So this is the real technique. So how we can stimulate this point? Keeping the middle finger here, 2 fingers on the side, and we are doing horizontal movement. So we are doing horizontal movement here like this. We are not rubbing the finger. That is not we are doing. We are sticking the finger, putting the 2 fingers on the side, and we are doing horizontal movement. If we want to stimulate our central heart, we are going. So how can we reach on this point? See, 2 finger up, that is for upper body, 2 finger middle, that is for the middle body, 2 finger down, that is for the lower body. So now just suppose we want to treat the upper body. So in between 2 finger, we will take 1 point. We will keep middle finger here and we will do stimulation like this. This is for improving the prana, the improving the energy, the improving the circulation in our upper part of the body. Now, if we go in the middle 2 finger, this is the middle 2 finger. So in between, we are having the Tal Hriday Marma, which is very effective for the heart. So just keeping the middle finger in the center and doing the stimulation, zigzag, and it is very effective for the patient suffering with a heart problem, circulation problem. Now we are going down, 2 finger. In between, we are taking this point and putting our middle finger and doing the zigzag movement. It is very effective if we want to improve the circulation in the lower part of the body. So just doing the zigzag movement. Even if we do the acupressure, little pressure like that, 1, 2, 3, 4. So if we stimulate this point 21 times, it is also very effective. We can also do 1, 2, 3. But the scientific stimulation is zigzag. Why? Because Marma stimulation is not very a scientific stimulation. We are stimulating the points in a way how energy move in our body. So the heart energy we have to stimulate in the horizontal way. So this was the first marma which I wanted to tell you, and also I wanted to give you message that marma means is not acupressure. It is very scientific stimulation based on the scientific aspect. So look at in this image. So we have to do 21 times. 21 times. So look at this image. So this is the head region. We can tell the heart for the head region, circulation for the head region. This is for the chest region. And this is for the reproductive part and lower body. So when we are doing the horizontal movement, we are doing 3 into 7, means 3 times, zigzag. 1, 2, 3. Then we are repeating this 7 times. So ultimately we have to do 21 times. So when any patient coming to you with a complaint of headache, dizziness, because headache, the reason of headache, maybe we have to treat the cause of headache. Finally, I will tell you complete protocol, but we have to treat the cause of headache. Some person may be feeling the headache because of the high blood pressure, high hypertension, or because of the heart condition. So we have to add this point. The name of this point is Tal Hriday Marma. Tal Hriday Marma. So this will be the our point. Second, so I will show you how to stimulate for the other person. Let's see here. I will demonstrate you 1 minute. So the proper way to stimulate the, so for that, because I want to cool down the heart, so I am taking little sandalwood oil and I am putting on my fingers. Then I am doing the rubbing of my finger because heart likes sandal very nicely. Now I can fragrance the, I can feel the smell of sandal. Now let's see here. So look at the palm. So when I want to do the stimulation, I will hold the palm of the receiver like this for giving proper support. Then because if I want to stimulate the upper part of Talihriday Marma, so I will mark all the 3 points. So this is the, we can see this is the upper part of the Talihriday Marma. This is the middle part of the Talihriday Marma. And this is the lower part of the Talihriday Marma. We can see here in this image. So when I want to stimulate, how can I stimulate it? I will take the hands of the receiver in my hand. Then what I will do, look at here. I will keep my middle finger here, 2 finger on the side. Now, I will keep my middle finger here, two finger on the side, and do the zigzag movement like this. Very gently. I will keep my one hand. I will keep the hand of receiver in my one hand. And from the other hand, I will do the manipulation. So middle finger is my main target, and I am moving the skin. If you see, I am moving the skin. I am not rubbing the skin. I am moving the skin. So I will keep all the three fingers together and I will do the movement horizontally. So this is the right way of stimulation. So this is the right way of stimulation of Talahriday Marma. When we see in the Tamil language, I want to tell you, whenever we talk about the Marma, we can't forget the Tamil Nadu, because the Marma Shastra has been written in the Sanskrit language as well as in the Tamil language. And we find a very wonderful literature in the Tamil language. And we salute all the Tamil gurus who has discovered this science, and still they are spreading the awareness of this science all around. So that's why when we see the name of Talahriday Marma in the Tamil language, the name of this Marma is Tat Chanai Kalam. Tat. Tat Chanai Kalam. So when we talk about the Tamil language has divided Marma, and they are telling Marma. They are not telling Marma, they are telling Varma. Yeah, or Varmam. In Hindi, we are telling Marma or Marmam. Even in the Sanskrit, we are telling Marma and Marmam. Even you go to the Kerala, you will find Marma and Marmam. But when you go to the South India, they will tell you Varma and Varmam. They, the Tamil gurus, the Tamil asanas, the Tamil guru who are very expert in the Marma, we tell them asanas, means expert guru. So they have divided Marma in two parts. One is they are telling Burma, second Kalam. Marma and Kalam same, both are Marma points. But what is the difference? The difference is same, like suppose there are two persons, one person this side, one person this side. But this person become this minister of the state. So this is also person having two arms, two legs. This is also person having two arms, two legs, everything same. But this person become the minister having more power. So in the Marma Shastra, when we tell the Burmam or Marmam, they are the Marmam points, and we are doing lots of treatment with the help of them. But when we tell them Kalam, the Kalam means they have got a special authority. They are having more power. So that's why when we talk about this Marma point, this has been told, the center Marma point has been told Tad Chanai Kalam. This is not a Marma point. This is the Kalam, means having a special authority. So if you just want to treat the heart, because we know this is the total 6 finger. So from here, if you go 3 finger, you will find a point which is Kalam or Tat Chanai Kalam. Means this point having a special authority. What is a special authority? With the help of this point, we can treat multiple heart conditions. Let's proceed to the next point. So if you find someone who is suffering with a heart condition, you can give them treatment and you can tell them to stimulate this marma point every day. So within few days, you will see they are much better with this stimulation. So now let's proceed for the next marma points. They are called Brahma, Vishnu, and Mahesh Marma. So Brahma Marma, Vishnu Marma, and Mahesh Marma. As for the Indian philosophy, we know the Brahma is a creator. Vishnu is doing the maintenance, and the Mahesh is responsible for the destroying unwanted things. If you see our body, in the human body, every day we need new cells. Every day we need new creation. The old cells is dying and new cells is forming. So the Brahma is always active in our body for the creation purpose. So Brahma is not something who is sitting upstairs or in the sky. So Brahma is the energy who is responsible for the creation purpose. Then every day in our body we need the maintenance work also going on very nicely. Because of this maintenance work only, we are having fixed blood pressure. We are having normal diabetes, normal sugar level. We are having normal calcium, magnesium, iron, all the nutrient in the blood and in the body. They are always same. Either you eat little more or you little less. But the maintenance work is always happening and they are maintaining the equal quantity which is required for the body. So this is the work of Vishnu. So Vishnu is not something having two eyes, two legs, two arms. This is the energy who is responsible for the maintenance. And when we think about the Mahesha, who is doing the destruction, what destruction is happening? In our body, we are destroyed daily, daily, we are destroying many unwanted things. We are destroying lots of dead cells. So all the debris from the body, all the unwanted things, all the undigested food, we are destroying every day. If we suppose, if we are unable to destroy the unwanted food, undigested food, dead cells from the body, then what will happen? The body will be a storehouse of dead cells. It will create multiple problems. Like we know in the malaria disease or in the dengue fever, when there is lots of blood cells get deposited in the spleen and spleen got enlargement, spleen get enlargement, and that is called splenomegaly. So we have to throw the dead cells outside of the body to maintain the health of the organ. So this all the destruction is going on with the help of Mahesha. So in our body, we are having three Marva points. They are called Brahma, Vishnu, and Mahesha. If we stimulate them, then we can improve the proper health. As well as these three Marva points is very effective for the migraine headache. Because these points available in the head region. So let's see. So look at this image. In this image, we can see the GB22, GB21, GB20. I have taken this image so that you can have clear understanding. The place of GB20, orbitalid governing vessel 20. This is also famous in the acupuncture. In the acupuncture, we are telling it $100 million point. And in the Marma Shastra, we are telling it the point who control each and every activity of the body, the supreme point of the body. Orbitalis Sahasrara Chakra, having near about 1,000 petals. So it means this point is very effective. So we can see here the governing vessel 20 or the Sahasrara Chakra, or in the Marma Shastra we tell it Kondai Koli. Also we tell it Adipati Marma, who is the supreme power of the body. So when we stimulate this point, this is the central point of the body, and this is work like a Vishnu for the maintenance purpose. So first I want to tell you about the GB20 or Kondai Koli, because this is one of the excellent point in the Marma. We are using it regularly. So let's see here. This is, we are seeing the skull from the top, and this is the location of Kondai Koli. This is the supreme Marma point. The supreme Marma point of human body, who control each and every activity, each and every activity. Kindly remember, I am telling activity of the body. The activity is a very important here. So the activity means function. Activity means something doing. That is activity. So when we talk about this point, first I will tell you the importance of this point. Then I will tell you how to find out exactly this point. So take the human body. Suppose this is the human body. You compress this body, like you compress this body and make this small. So same human body, but I am doing the compression and I'm making it small. Now I am doing little more compression. The same body, I did more compression. Now I am doing the highest compression. This is the compressed human body. What is the meaning of this? Like here we can see, this is the head, this is the reproductive part, and also we are having feet. All the three organs we are having here also in the second image, all the three organs we are having in the third image, and all the organ we are also having in this spot. Now, take this spot and keep it here. So on the Sahasrara Chakra, on the Kundai Koli, we are having full compressed body. It means with the help of this point, we can treat head region, we can treat the reproductive part, we can treat the pain happening under the feet, means pain of the soul. So if someone is telling you, can you treat my head? What is head? What is head? What is the problem of the head? The meaning of head, it may be epilepsy, it may be migraine, it may be all the psychosomatic problems, it may be anything which is happening in the head region, including head, eyes, ear, and all. What is the meaning of reproductive part? The meaning of reproductive part here, we can treat all the problems connected with the uterus, ovary, prostate, and all. What is the meaning of feet? We can treat if someone is suffering with the numbness under the feet, with the tingling sensation under the feet, with the pain in the heel. So just one point, because the full compressed body is there. So if we do the stimulation of this Kondai Koli, never think and never underestimate this point. This is a single point having wonderful capability. And this is the one of the most important point in the Marma Shastra. This is the most important point of the Marma Shastra. So when we stimulate the Kondai Koli, there is a very specific technique of stimulation of this point. We are also telling this Vishnu Marma. We are also telling you the meeting point. So the meeting point means all the energies are meeting here. Energy from all the direction are meeting here. So let's understand this meaning. So this is the human body. If we divide human body in multiple parts, like this is a central part, this is a side part, this is the other side part, even in the back side, this is the center, this is the side, this is the other side. So all these points are meeting on the junction. So this is the junction point of all the energy pathway coming from right side, left side, center, back, back left side, back right side. So when we stimulate this Kondai Koli, this point having influence for each and every part of the body. That's why we are using this point or Kondai Koli for paralysis, for pain in the arm, for pain in the legs, for improving the energy and enthusiasm. One day what happened? One lady came to my clinic and I stimulated this point. And she told that after a long time, today I felt improvement in my uterus because my uterus is coming out daily. my uterus comes out daily. That is called uterine prolapse. So just with the help of 1 point, we could prevent the uterine prolapse. Not only uterine prolapse, all the reproductive problems. You can enhance the reproductive energy. You can improve the erectile dysfunction, male and female reproductive problem, leukorrhea, white discharge, reddish discharge, polycystic ovary, all the reproductive problems. With the help of 1 point, we have seen very good results, especially if anything happening with the head region, anything happening with the reproductive part and in the feet. This is the best point. And anything happening in the arm and legs, like pain and numbness in the arm and leg. And this point is also Vishnu Marma. So this point is responsible for the maintenance purpose. Means if we stimulate this point is very much effective for maintaining the hemoglobin, iron, calcium, magnesium in appropriate amount. So when anyone suffering with a complaint, when anyone telling you, can you treat my migraine headache? Definitely we have to stimulate this point. This is the one of the best point, because we are having the head region here. In the Ayurveda, what we do after the treatment, every time we put one powder here. The name of this powder is Rashnadi Churna. This powder easily available in the market. Why we put this Rashnadi Churna? Because when we do some Ayurveda Panchakarma treatment, during the Panchakarma treatment, body is very light, very sensitive, like a small baby, like a female. We have seen the female body is very sensitive just after delivery. In the same way, if we do the very vigorous Panchakarma, like 30 days Panchakarma, 20 days Panchakarma, very vigorous Panchakarma to detoxification purpose for the purifying complete body, that time body is very light like a baby. If during that time patient doesn't follow the rules and regulation, then doctor always tell better not to do the Panchakarma, because it is very effective procedure who will rejuvenate your body, but you can't do everything. You have to follow all the rules and regulations. So what we do here, we put Rashnadi Churna. So with the help of Rashnadi Churna, we can avoid multiple complications, because Rashnadi Churna is the Churna, Rashnadi powder is the powder who keep away all the Vata disorder. Vata means there is, if Vata, the keeping away Vata disorder means there will not any chances of getting the attack of Vata, the attack of migraine, the attack of pain, the attack of slip disc. Because if someone is doing the Panchakarma treatment and suddenly he lift a very heavy weight, so there is chances of slip disc, because body is very light. But after completing the Panchakarma and taking the rest for 10 days, 15 days, then he can perform all the action. So this is the place after every Ayurveda treatment, we always put something here like Rashnadi Churna on the Kondaikoli Marma point, Kondaikoli. So if we want to stimulate this point, how can we do? Let's see the practical demonstration. So first I will tell you the exact location here. So how to stimulate this point? Locate here. First, we should find out the exact location. So this is the third eye. From this point, we have to go forefinger up. Then we will get hairline. So from the third eye, the distance of hairline is forefinger. So we can keep forefinger. So we can reach on the hairline. Now from here, if we go from here, if we go again 4 finger, then 3 finger. How many finger total? 4 or 3? 7. So from the hairline, if we go 7 finger back, so 4 finger and 3 finger. So under the 7th finger, we are having this point. Under the 7th finger. Many person tell us that this point is available in the where we are having burl pool of hair. But we will also stimulate that point, but we have given different name. So when we talk about the condyle, it is 7 finger back from this point. So 4 and 3. So this is the point of this is the condyle. How can we stimulate this point? And this is the point which is very effective for multiple conditions, which I told you. They are the good for connected with the head region like migraine headache, epilepsy, all the nervous system disorders, for the reproductive problems, for the pain in the heel, anything which is connected. And this is the governor point of all the activities in the body. So we will keep the middle finger here. We will keep the middle finger here. And 2 finger on the side. Always remember, we never stimulate Marma point with the tip of finger. This is the wrong stimulation method. We always stimulate the Marma point with the pulp of finger. Because if you see the pulp, in the pulp we are having some energy chakras. And the center is the real point, which is the real point which we touch with the Marma point. So never we do like this. We can do like this. This is a real stimulation. So we are touching the pulp. We are touching the pulp. We don't do this. This is the wrong method. If some Marma asanas will see you doing this, he will scold you because this is not a Marma stimulation. The Marma stimulation can be done just by the pulp. Because in the pulp, we are having Marma chakra. And in every chakra, we are having center point. With the help of this point, we can receiving the energy and expelling the energy. So when we do like this, the chakras of the 2 finger are meeting with each other and there is a formation of circuit which is balancing our energy. So that's why this is the best pose to balance our energy. If you do this thing, all the Purush and Prakriti, yin yang, hetero, homo, plus minus energy of the body will get balanced because of the action of the Marma energy. So I am not keeping the tip of my middle finger. I am keeping the pulp of my middle finger and keeping 2 finger on the side. Then again, I will do zigzag movement. The meaning of zigzag movement is like this. This is zigzag movement. But this movement I will do on the Kondaikoni. So let's see here. 1 minute. 1 minute. So I will tell you, I will show you the practical demo. Here. So let's see here. First, I will show you how to do the stimulation. Then I will tell you about this point. So let's see the practical demonstration. From the hairline, we are going 7-finger back. So this is the location of Kondai Koli or Vishnu Marma. We are keeping our middle finger there on the Kondai Koli, keeping other 2 finger on the sides. Then we are doing zigzag movement, means horizontal movements, right and left side. So in this way, we will do 3 zigzag movements. This is called 1 set. In that way, we are doing 7 sets. So the 21 times stimulation, it will be very effective for the Kondai Koli stimulation. This was the stimulation method. Now look at me. I am keeping my middle finger here and doing the zigzag movement. You can see the movement of my head, but I am not rubbing the finger. So you can see the movement of my head. So many Marma asanas in the ancient time used to do this movement in 2 ways. Number 1, they used to do the stimulation of this Marma point, first zigzag. Then after completing the zigzag, they are making the moon till the ear, touching the ear, making the moon, then rubbing the finger. So in this way, so we can do 7 in the 1 round, 3, 1, 2, 3. In this way, we can do the 7 repetition, total 21 times. It is a very effective stimulation technique. So like see, 1, 2, 3, relax. 1, 2, 3, relax. 1, 2, 3, relax. In this way, and after completing this process, we can make 1 moon. So the purpose of making moon, we are taking the energy and also adding 1 Marma point. There is 1 Marma point here also. We are combining the energy of 2 Marma points with each other. So this is the stimulation method of Kondai Koli. So this is a very effective point, Kondai Koli, which is 7 finger on the back side from the hairline. At many places I have seen 6 finger, but 6 finger doesn't work practically so nicely. So we are going 7 finger back. Okay. So this point is 7 finger back from the hairline, and the length of the forehead is 4 finger, then 7 finger. So from the third eye, you can go 11 finger. So from the third eye, if you go 11 finger, 4, this is 8, and 3 finger, this is the 11. So under the 11th number finger, we are having the location of this point. So we are doing the 3 zigzag movement in 1 round. Then we are repeating 7 times. So we have to apply the pressure, very gentle pressure, like we don't have to apply much pressure. We have to apply very gentle pressure. Like if you are doing the treatment for even there is a very big person sitting in front of you, like 40 years of old. But when you stimulate the point, just bring the feeling that you are giving the Marma treatment for 1-year-old baby, 1 year. Then you can understand how much pressure you required, because 1-year baby is very soft and delicate. So that much pressure is enough. I have seen practically it become very challenging for the person who is doing acupressure treatment. It become very challenging for them. Because I have seen, because I have taken many Marma trainings at many places. There are many person who is doing acupressure. They are also joining the training. It become very challenging. I tell 10 times. Even after that, the person who is doing acupressure, they apply the pressure. Because in their mind, they always think that without pressure, how can it work? So I will tell you, when we are giving blessing to someone, we are just giving like this. We are not doing blessing like this. The blessing we are not giving like this. We are just keeping our both the hands over the head of someone, blessing. May you live long, like this. So Marma is a blessing. Never think that we are doing the acupressure, so you do the vigorous acupressure. If you do the vigorous acupressure, there will be Marma ghat, means the damaging of the Marma points, and it may create some pain. Then person will tell you, oh, my pain aggravated. So whenever you do something wrong and person is telling you that, oh, my pain is aggravated, so please do one point for nullifying all the negative fact. We know this is the ear. This is the ear. In the ear, we can see this is the structure. The name of this structure is tragus. So hold this point and move this point. So we are moving this point. We are moving front and back because inside of this point, we are having adrenal glands. So when we stimulate the adrenal gland, it secretes the emergency hormone, which nullify all the negative fact. So why? Means by mistake, you have done something wrong. Wrong thing will happen only in one condition, when you do more pressure. Because we are not trying to harm someone. If you give the gentle pressure, there will never be harm. Never be harm. Just give gentle pressure. Your healing hand, after a few days, you will feel, as soon as you touch the person, energy starts flowing from your hands. So always remember, please do not do more pressure. Do not give more pressure. Otherwise, it may bring little harmful effect. If you are doing the point, person is doing like this is wrong. The face of the person should be relaxed and normal. Like when we are doing acupressure, that time what happened? We are pressing the point, person is telling, we think, oh, this is the correct point. In the Marma, it is not like that. The patient face should be very much relaxed. So this was the second point, the Kundai Koli. Now, from this point, this is the Kondai Koli. Now, from this Kondai Koli, if you go 2 finger back, this is one point. And from this Kondai Koli, you come 4 finger front. This is another point. So finally, we got 3 points. From the Kondai Koli of Sahasrara Chakra, we are going 2 finger back and 4 finger front. So these are the 3 points: Brahma, Vishnu, Mahesh. The Brahma is connected with the creation. The Vishnu is connected with the maintenance, and the Mahesh is connected with the destruction. The Brahma is also called anterior fontanel. When we see the newborn baby, this part is very soft. So we never touch this point for the newborn baby. But we can put the castor oil here for the newborn baby because this part is open. Also, the Mahesh Marma is also open in the newborn baby. This is called the posterior fontanel. We know that this part of the newborn baby is a little softer, that is Brahma. Now we are coming in the center, that is Vishnu, and the back part is also a little sensitive, that is Mahesha. So with the help of these 3 points, what we can do? With the help of Brahma point, we can treat the nervous system. With the help of Vishnu point, we can treat the liver, pancreas, stomach, and with the help of Mahesh point, we can treat all the reproductive problems. So with the help of Brahma, Vishnu, Mahesh, we can treat whole body. Many female during the menstruation having headache problem. Some person having gastric discomfort and suffering with the headache problems. And many person having some nervous problems and they are suffering with the headache. So we are stimulating all the 3 points because the headache is a message of the body. Headache is not a disease, headache is a symptom. The migraine is a symptom of the body and we have to treat the root cause. So we will treat the Brahma, Vishnu, Mahesh. The stimulation method will remain same. The zigzag movement. 3 into 7 round. So we'll do now from the hairline. If we go 10 finger back, sorry, from the hairline, if we go 11 finger, that is the location of Kondaikoli. So this is the Kondaikoli. Which is 7 finger back. Now from the hairline, so from the hairline, if we just go 3 finger, that is the place, Brahma Marma. From the hairline, we are going just 3 finger. That is the place, Brahma Marma. That is the creation. That is the good for nervous system. In the acupuncture, if we are inserting the needle here, it is treating all the nervous system disorder. In the Marma Shastra, when we are doing the stimulation of this point, zigzag, it is treating all the problem connect with the nervous system disorder. Kondai Koli is treating all the problem connect with the abdominal region. And same movement we are doing in the back side. We are keeping our middle finger and doing the zigzag movement. Same movement, zigzag movement, Brahma, Vishnu, Mahesh. So with the help of Brahma, we can treat the nervous system disorders. With the help of Vishnu, we can treat the abdominal problems. And with the help of Mahesh Marma, we can treat the reproductive problems. Acupuncture is putting the needle here for nervous system, putting needle here for the digestive disorders, and putting needle here for the reproductive problem. But these things very beautifully explained in the Marma Shastra with the name of Brahma, Vishnu, Mahesh. So Brahma for the upper body, Vishnu for the middle body, and Mahesh for the lower body. So with the help of these 3 points, we can, because we have to treat complete body. If some female is coming for the treatment of headache during the menstruation, so we can help her with the Mahesh point. Gastric problem, Vishnu point, and headache because of nervous system disorders, Brahma point. Okay, so we have learned Talhirde Marma, then Brahma, Vishnu, Mahesh. Now we are coming to the third eye. We are coming to the third eye. Then we will make a complete package and we will learn how to resolve the headache with one flow treatment. So this is the third eye. The name of this point is Tilarth Kalam Marma. From the hairline, Brahma Marma is 3 finger. From the hairline, Vishnu Marma is 7 finger. And from the hairline, Mahesh Marma. From the hairline, the Mahesh Marma is 9 finger. 9 finger. So 2 finger more. And we will find pit there. We will find pit there. And if you see the hair, you can find one whirlpool of the hair on the back side, where we keep the choti. That is the Mahesh Marma, choti. Where we keep the hair. That is Mahesh Marma. So this is the Brahma, Vishnu, Mahesh. Coming to the third eye. The third eye is the excellent point for lungs disorders. I am giving you answer. In the Marmasas, it has been told in the human body, we are having 10 types of Vayu. In the Marmasas, it has been told that in the human body, we are having 10 types of Vayu. Vayu means who always move like a horse, because horse is always moving. So we are having 10 Vayu, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And with the help of these 10 Vayu, we are performing different action of the body. Like one Vayu is responsible for digestion, one Vayu is responsible for elimination of the stool, one Vayu responsible for the circulating the blood. In that way, we are having 10 Vayu in our body. So these 10 Vayu is like a 10 horse. Now, these all horse are tied with one rope. And this rope is connected with one rope. And this all ropes connected with Tilarth Kalam Marma. So it means if you stimulate the Tilarth Kalam Marma, you can control all the 10 Vayu. 10 Vayu is responsible for all the activity in the body. So that's why the Tilarth Kalam Marma is very much important, which is also connected with the pituitary gland and also connected with the headache and migraine, but the control of all the activity in the body. So the name of this Marma is Tilarth Kalam. We also tell it Sthapni Marma. And how to stimulate this point? Let's see here. We will keep the middle finger here. We will keep the middle finger here. And we are lifting this point up. 1, 2, 3. We are not rubbing. We are not rubbing the point. We are keeping the finger, lifting it up. 1, 2, 3. So we are lifting the point in this way. This is a stimulation method of the Tilarth Kalam Marma. Or we are taking some chandan or kumkum. We are putting like this. We are stimulating this point upward. Because from this point, if energy is going upward, it improves the consciousness, awareness, alertness. But when from this point energy is going downward, it increases the anger. So that's why if you do lots of meditation, your awareness will increase. But suddenly if your energy is flowing down, you will be very aggressive and angry man. So when energy is flowing upward, it is lifting your consciousness. When energy is flowing downward, it is damaging your energy system and damaging your aura, damaging your essence of the body. So this is the place of Tilarth Kalam Marma. So this is the stimulation method. We can morning, as soon as we get up from the bed, we can stimulate this point upward for improving our consciousness. So this is the one of the point. When we do the moxibation here, moxibation means when we stimulate this point with the help of heat. So rub the finger and put it here. This is the heat. When we do this Stimulation with the help of moxibustion means rubbing the finger and keeping here. Do then this is excellent for asthma and lungs disorder. If you want to treat the asthmatic patient, you can use this Tilarth Kala Marma, do the moxibustion, give the heat. Do not stimulate this point is too much because now this is very supreme point. So when we are doing stimulation, 21 times is more than enough. You can reduce the frequency. You can stimulate the point 11 times, but do not go more than 21 times. So this is the, so how we do? We are rubbing the finger and keeping here for 5 seconds. We are rubbing the finger, keeping here for 5 seconds. Do 21 times. You will see the miraculous result for the asthma patient, for the patient suffering with cough and cold. And if you want to do meditation, before the meditation, you can do this process. If you're suffering with any water disorders like joint pain, poor circulation, asthma disorders, indigestion, constipation, headache, this is the best point. Tilarth Kala Marma or Stapni. Or if you want to stimulate this point in our this headache package, you keep the middle finger here, lift it up. 1, 2, 3. 3 times. And repeat this for 7 times. So this point will increase the immunity. This point will make your defense system stronger. If you do the regular, like regular means every alternate day. Even Marma therapy can be repeated after 6 hours. So if you ask what should be the frequency, you can do every day. You can make your defense system stronger and you can keep all the lung disorders keep away from here. Either this is the viral infection or bacterial infection, any disease which is attacking your lung, you can keep away all the diseases with the help of this point. These are very effective points. Let's see another point. So when we go from the eyebrows, where eyebrows ends. So when we go from the eyebrows, where eyebrows ends. From this point, we have to go 1 finger up and we will feel depression here. Why this depression formed? The name of this point is, in the Sanskrit we tell it Apanga Marma. Let's see here. Definitely we can use the moxa stick. Yes. Look at this image. The name of this point is Anankalam or Apanga Marma. We can see in this image where this eye is ending. From there we feel the depression. Why we feel depression here? I have shown in this image. In this image we can see this is one bone, this is another bone, this is another bone. The name of this bone is parietal bone. The name of this bone is zygomatic bone. The name of this bone is, here is temporal bone. So this is the junction of multiple bones, where multiple bones unite and they form the depression. So that's why when we stimulate this point, I already told you when bones are uniting with each other, and we can see the multiple bones are uniting with each other at this point. So this point is become very effective for 2 conditions. Number 1, definitely headache, or number 2, all the kidney disorders. All the kidney related disorders, this is one of the best points. So when someone doing overwork, he may feel headache at this point. So how we stimulate this point? Look at here. So we keep our thumb here. So first touching, pressing, Then lifting it back. 1, 2, 3. Look at here. 1, see, touching the point, doing little pressure, not vigorous, and lifting this point on the back side. 1, 2, 3. 1, 2, 3. We are not going like this much, just gentle. 1, 2, 3. And the person who is doing overwork, they will feel the pain here. So we are doing both the point together. See, 1, 2, 3. In my Panchakarma clinic, I always tell to my therapist, please, when you do the face massage, you keep your one finger here, like. Patient feel very effective, because if you touch this point, most of the person coming for the treatment, they are stressful, they are in the anxiety, they are doing overwork, they are not sleeping properly, doing work on the computer. So this point is very effective for the eyes, because we are having lots of strain in the eyes. So with the help of this point, we can relax our eyes. We can improve the vision. We can improve the headache. So this point is called Apang Marma or Anan Kalam. In the medical system, we tell it Terion. The name of this point is Terion. The junction of multiple bones. The junction of frontal bone, parietal bone, and temporal bone. So this is the junction. So frontal bone, parietal bone, temporal bone, and zygomatic bone. And this is the junction of 4 bones. That's why we feel the pit here. The name of this point is Apang Marma or Anankalam. How to find out? Going from the eyebrows, reaching to the lateral angle of the eyebrows. From this point, going one finger up, we will feel the natural depression here, and we will touch this point and lifting it back. The second type of stimulation, we can just do the pressure here, and we can do the clockwise 3 rotation and anti-clockwise 3 rotation. This is the second stimulation. If you do vigorous acupressure here, this point will be painful for 3 days. Then patient will not come back. So don't do vigorous pressure. Just do mild stimulation. Very mild stimulation, like baby touch. So the name of this point is Apang Marma. Let's see last point. Now look at this, look at the head of this person. What is this? What is this? What is this? And what is in the back side? Even in the back side, we can see. What is this? So this is the junction of 2 bones. This is one bone, this is another bone, and this is the junction. In the same way, if you see in the front side, this is the one bone here and one bone here, this is the junction. So the junction means border. The junction means border. And we tell the border in the Sanskrit or Hindi, Seema. So we tell this Marma, Seemanta Marma. The meaning of Seemanta Marma, where 2 bones are uniting with each other. So in the head region, we are having multiple bones. In the skull, we are having multiple bones, and they have united with each other with the help of these sutures. And we can see the sutures, and if we try to separate these 2 bones, then it gives very wonderful feeling and release the headache. So this is called the water. the uniting of two bones, or we tell it Simanta Marma. Simanta Marma. So let's see how to stimulate this point. So what we are doing, we are keeping our forefinger one side, forefinger other side, and we are keeping our palm on the on this Apanga Marma. Then what we are doing, we are with the help of pulp, we are pulling the Simanta Marma away from each other with a feeling that we are trying to separate the suture. We are trying to separate the right side of the bones with the left side of the bones. 1, 2, 3, relax. 1, 2, 3, relax. We are repeating this 21 times. So this is called Simanta Marma. Let's see here. In this image, we can see very clearly the border of two bones. And when we try to separate the right side of the bones, with the left side, so this separation gives the pressure effect, stretching effect on the suture. And when we try to stretch the suture, it releases the stress, it releases the headache. So this is called Simanta Marma. So finally, when we doing the treatment for the person suffering with a migraine headache, how we start? We will start from here. Actually, there are few more points, but this package also enough. We see wonderful results with this much package as well. So let's see how can we stimulate the point. So we will start our treatment with the Talhirde Marma, means from the palm. So we'll start our treatment with the Talhirde Marma or palm. Then we'll stimulate this Simanta Marma. Then we'll go to the third eye. So look at here, how we go step by step. So let's see here. So when we are doing the treatment, first we are doing the blessing. Minimum for 10 seconds to 30 seconds. After that, we are doing the stimulation of Talhirde Marma. 1, 2, 3. 1, 2, 3. 1, 2, 3. We are doing in the other hand. 1, 2, 3. 1, 2, 3. 1, 2, 3. 3 times completed. Now we are coming on the head region, trying to separate the border and is doing the stimulation of Simanta Marma. 1, 2, 3. 1, 2, 3. 1, 2, 3. So we will do for 21 times. Then we'll start from here. Third eye, then Brahma, Vishnu, Mahesh. So lifting the third eye upward. 1, 2, 3. Relax. 1, 2, 3. Relax. So in this way 21 times. Then Brahma Marma, zigzag movement. 1, 2, 3. Relax. 1, 2, 3, relax. In this way 21 times. Then going to the Vishnu Marma or Kondai Koli, relax. 1, 2, 3, relax. 21 times. Then reaching to the Mahesh Marma, 1, 2, 3. In this way 21 times. So we have stimulated 4 points. After this, we are coming to the Apanga Marma and we are lifting this point in the backside. 1, 2. We can also do that. 1, 2, 3. 1, 2, 3. Because when we are doing the person who is sitting in front of us, then position will be buried. So we are doing stimulation in this way. And after that, after completing this point, so we have completed the Talhirde Marma, we have completed the Tilarthkala Marma, Brahma, Vishnu, Mahesh, we have completed the Apanga Marma, and after that, at the last, we will again stimulate the Simanta Marma. This is the protocol number 1 for the migraine headache. We are also having protocol number 2 for the migraine headache, which we are going to discuss tomorrow for the enrolled participants, because this was the free session. And believe me, these points are very effective. If anyone is suffering with a migraine headache, just to do it and see the results. I have taught this technique to many patients and they got very good results. So we are having the headache protocol 2, which we will discuss tomorrow for the enrolled participants, because in this session we have limitation of time. So we cannot discuss the complete protocol, but what I discussed today, it is also wonderful. You can try this and you will achieve the very good results. Thank you so much. अब हम थोड़ी देर में हिंदी में चालू करेंगे. देखिए अब हम हिंदी में चालू करेंगे. तो हिंदी में चालू करने के लिए हम लोग पहले 10 मिनट का, देखिए मैं एक चीज बता दूं. हाँ, पहले कोई इफ यू वांट टू आस्क एनी क्वेश्चन, सो यू मोस्ट वेलकम. इफ यू वांट टू आस्क क्वेश्चंस, प्लीज you can ask right now. I am giving you time. Okay. So the thing is this, I will keep on doing the free session to spread the awareness. But if anyone want to join our details workshops of the Marma therapy, which we are starting from tomorrow, because today is the first day and today I kept for everyone free. If any one of you want to enroll, can enroll in that workshop. We will learn how to treat the cervical spondylosis, how we'll treat the lumbar pain and lumbar spondylosis, how to treat the leg pain, knee pain, each and every pain of the body, how to treat the eyes problem, asthma, erectile dysfunction, pain in the arm, pain in the legs, distance marma. We are giving the marma from distance. So we are going to learn a very wonderful things in a very beautiful way. We will do more practical, because today we did less practical, but we are also going to do more practicals. So if anyone want to learn in the details, they can enroll. They can enroll with the help of links, or they can send me the message. If someone is having migraine headache or is stressful or having some like not feeling good enough, you can give this treatment. It's not compulsory to give only that time that person having problem. Or you can harm the person only in the one condition, if you do the vigorous pressure. So be gentle. Do not give vigorous pressure. You will never harm anyone. See, within 2 days, your patient will tell you, doctor, I'm feeling very good. But I will recommend you give this treatment at least for 7 days. And you can tell the patients, you can teach him few points, so there will be no recurrence. We are pulling the triggers to nullify the negative effect if they happen because of wrong treatment. Because maybe you have given more pressure than required and person is telling, doctor, after the treatment, I'm feeling little uneasy. So you can stimulate the tragus. See, this is the class for especially our migraine headache. The calf muscle session we will discuss in the legs. We cannot discuss in this class because that is very big section. We are starting course from the zero level, very basic level, and we will go in the advanced. So we will learn from the very basic levels from the tomorrow onwards at 5:45 every day. And for the enrolled participants, we will also provide the complete recording of the course for 1 year. And today recording also will be provided to all the enrolled participants because I have made the final group for all the enrolled participants. So I will provide the recording of this course to them. We can do that treatment for that. That class will go for 21 days. That is a 21 days class. 21 days, 21 hours. We will also learn the treatment of the navel because in the Marma session we are covering whole body. It will be 1 hour every day. Yes, it will be 1 hour every day. It will be daily 1 hour class. Maybe sometime it will go a little more like 15 minutes, like 1 hour, 15 minutes. But if someone is busy, I will provide the complete recording of class, of everyday class. Tragus stimulation is all the negative, if you want to nullify all the negative facts from the body. The participant who has registered, for them I will give manual, step by step points for the registered participant. For the enrolled participant, I will provide manual, like how to do the treatment, how to jump from one point to other point. The timing is 5:45 every evening. Class is already, today is the first day of class, but tomorrow onwards, we are starting from 5:45 p.m. in the evening. We can stimulate all the point 21 times, but we can reduce the stimulation of this point because this is very highly effective. We can stimulate this point 11 to 21 times, but no, not more than that. So if suppose if you are not able to attend the class, I will provide you recording for 1 year, 12 months. You can watch anytime as per your convenience. So the fees of the full course is 6,650, 6650, 6650. Vishnu Marma definitely can be used for the liver, gallbladder, pancreas, stomach, all the problem connect with the abdominal region. The Marma works, if you give the Marma treatment, 7 treatment, they are very good for the tailbone pain. For kidney, we are having separate protocol. We are going to discuss. See, I will share you the link. You send me WhatsApp. I will share you the link. I am conducting many other courses of the acupuncture also. So this is my number. Note down this. And I will share you all the details regarding my courses. My all the courses available online. You can enroll anytime and you can watch the recordings there. And I am also going to conduct many courses in this month. You can also have the inquiry for that. This is my number. I'm sharing my number. So you note down my number. You can ask for any courses. There is any direction of fingers towards front and back? No, only zigzag. When we are doing in the back side, We are doing zigzag, means right to left only. So you can send me message on the WhatsApp. I will tell you the detail about my courses. Then you tell your interest, because I have conducted many courses. All courses are already recorded video available online on my website. So you see what is your interest. Then accordingly you can choose and then we can discuss. We will provide the course manual. We will provide the practice manual. We will provide two things. One is practice manual. Second is recorded video. There are all the problems, like people are suffering nowadays, this pain, that pain, this digestive problem, back pain, neck pain, multiple disorders, lots of disorders of the nowadays we can cover, we can resolve with the Marma therapy. My number is 816 0088 512. I'm repeating again, 816 0088 512. This is my number. You can send me WhatsApp. I will reply you. Definitely you can treat others as well as yourself. Our Marma means today class is completed. Now after completion of this class, we will do 10-minute break. Then we'll do the class in Hindi. इस क्लास के होने के बाद हम 10 मिनट का ब्रेक करेंगे, फिर हम हिंदी में क्लास फिर से करेंगे क्योंकि हमारा कमिटमेंट है. और तो आज की क्लास फिर हो जाएगी, फिर हम हर रोज 5:45 से क्लास करेंगे. हम वी कैन ट्रीट स्किन डिसऑर्डर आल्सो. So the participant who will enroll, we will also award them with a certificate, the completion certificate. We have very excellent results for the depression. Excellent. The depression, psychosomatic disorders, Marma is the best therapy for them. Okay friends, अब हम थोड़ा सा ब्रेक कर रहे हैं. डायबिटीज के लिए भी हमारे पास बहुत अच्छे पॉइंट्स हैं. We will discuss. So now we are doing 10-minute break. Then we'll repeat the session in Hindi. आपके कोई भी प्रश्न हो, the ID will remain same. I'm not going to close this meeting. This meeting will open. So the participant who joined for English, they can leave the group. Those who want to be here, they can be here. और जो भी हिंदी के लिए ज्वाइन करना चाहते हैं वो 10 मिनट के बाद आ जाइएगा वापस. That is your wish. Great. So you did treatment for yourself, you're feeling light. Yeah, this is the effect of Marma. Okay, fine. तो अब मैं 10 मिनट का ब्रेक दे रहा हूं और जो भी हिंदी वाले लोग हैं वो बने रहिएगा. 10 मिनट के बाद हम पूरा सेशन हिंदी में रिपीट करेंगे. ठीक है जी? थैंक यू सो मच. वी सी यू आफ्टर 10 मिनट्स. एवरी डे क्लास विल बी इन इंग्लिश एंड हिंदी बोथ लैंग्वेज. हर रोज हिंदी और इंग्लिश दोनों में क्लास होगी.